Today we're going to see about a complication which arises after a mastectomy or axillary clearance, which are being done for patients who has been presenting with breast carcinoma. These both are common surgeries which done on a patient presented with breast carcinoma, else their carcinoma is a metastatic carcinoma. Both of those procedures, complications, can be divided into immediate, early and late as well. If we see into mastectomy, the immediate complication is bleeding. We cut into a vessel and that vessel bleeds. If we see into early complication, the patient can form seroma. The seroma is a serous fluid accumulation as well as hematoma, which is a blood accumulation. And also we close the incisions with flaps, and flaps can be necrosed. If those flaps are necrosed, we can get infection. So you can remember the initial seroma and hematoma can be formed, then flap can be necrosed. If something is necrosed, you can get infection. You just can't keep that in that way for the remembrance. If you see into a late complication, a keloid scar formation is a common one and most obvious one you can see in many patients. And also you can get recurrence as a late complication. If you see into axillary clearance, same as the mastectomy, we can get bleeding. You cut into a vessel and that vessel bleeds. This occurs in the table, the operation table. Other than this, there can be nerve injuries as well. There are three common nerve injuries which occurs in axillary clearance. The first one is the intercostal brachial nerve, which runs between your ribs and supplies the skin over your axilla. So if this nerve is being cut or damaged in the surgery, what you get is a paresthesia of your axillary area. And the next one is a thoracodorsal nerve. The thoracodorsal nerve is the nerve which obviously supplies your latissimus dorsi. If your latissimus dorsi is cutted and affected, what happens? Your shoulder's extension capability will be limited or affected. The next thing happens is your long thoracic nerve. That is the third common nerve which affects in axillary clearance, which supplies to serratus anterior. We all know it's a common phenomenon which calls wing scapula. It's a famous phenomenon, not a common one. It's a famous phenomenon. The damage of serratus anterior causing wing scapula. You can remember like the long was the shortest nerve which supplies the serratus anterior. The long was not the longest one, that was the thoracodorsal nerve which supplies the latissimus dorsi. Then you can see the early complication. There, the axillary vein also runs towards your axilla. So in this procedure, what you can do is you can damage your axillary vein. One vein or an artery, whatever it's damaged, you can form a thrombus. So axillary vein thrombosis is another complication. If we see into a late complication, the lymphedema. We are removing the lymph nodes in the axilla, so lymph can be accumulated and lymphedema can be formed. The next one is shoulder stiffness, immobilization of the axilla causing shoulder stiffness. Thank you.